Hi everyone and welcome to this webinar. We're just going to wait a couple of more minutes just for some more people to join, and then we'll start in around 2 minutes. So I think we can maybe start. So thank you for everyone for joining us today for this EENA webinar. We'll start with just some practical things. So just to know that all of the participants will be muted during the webinar, but you can of course click to raise your hand. So if you click on the hand symbol, we'll know that you would like to ask a question once the presentation is over. And you can also ask any questions at any time during the presentations in the chat. And so these will appear in the questions panel. And this means that when we have the question time after each presentation, we can then read out your questions to the presenters. So thank you again for joining us today on the World Day for Health and Safety at Work. So today we just wanted to highlight some of the important issues facing the emergency services in the workplace. And this includes both psychological and physical aspects that are both involved in these very demanding roles. So today we have two different presenters. The first presenter will be Daniel Sundahl, who's a first responder, a mental health advocate, and an artist over in Canada. And the second speaker we have will be Steve McLinden, who is the T20 Digital Programme Manager at Mid and West Wales Fire and Rescue Service in the United Kingdom, and he'll be speaking to us about situational awareness. So without further ado, I'm going to pass it over to Daniel, who's going to do the first presentation today.
All right, thanks, Rose. I want to make sure that everyone can see me okay. Can everyone see my screen all right?
Yes, perfect.
Okay, great. All right, well, thank you, Rose, and thank you everyone at EENA for inviting me to come to this webinar. I'm really excited to give this presentation. Now, a couple of disclaimers. I'm not a mental health professional. I'm not a therapist. I am a full-time paramedic firefighter, and I create the artwork, and I do promote mental health awareness. I am an advocate, but I do travel, and I have spoken to thousands of my peers when I travel around the world and exhibit my artwork. And I always ask about their mental health and the programs that they have. And after visiting many countries and speaking to thousands of you, I've gained a little bit of insight on what I feel building a mental health sanctuary or creating a mental health and safety and emergency services could look like, based on what I've seen other services do. So a little bit about me. This is me and my wife Roxanne. This is when we did a paint night, which is we do this painting. Now Roxanne is holding the painting of what the painting should look like, and what I'm holding is the painting that I created. I asked the organizers for some red paint, and she said, well, there's no red paint in this painting. I'm like, I know, I want some red paint. So that gives you a little bit of insight as to where where my brain is as an artist and how I express myself. And I use this artwork to express my own feelings and to express the trauma that I experienced. Here's another painting that I did when I was in England a couple years ago. This is called The False Okay. And here's a paramedic. He's looking very confident. He's looking very strong. Yet there's this big demon behind him. And his name tag says, please. And this is the false okay. And this is how I felt, and many of us have felt and are feeling, where we are struggling with these mental injuries, but we don't share them with anybody. We don't let anybody know because we're very good at hiding how we actually feel when we put on this pretty good show of, we're still good, effective emergency workers, yet we're struggling and we're carrying these demons and these trauma. Now, some of my artwork, another disclaimer, some of my artwork may be a little bit graphic. I don't censor my artwork, and I do use angels and demons in my artwork to represent trauma and recovery. And again, this artwork is how I express and process and purge the mental traumas that I've had. Here's another image that I created for my psychologist, probably about 5 years ago now. And here's a paramedic. He's surrounded by his demons. He's got a tourniquet on his arm, and he's got a syringe full of narcotics. And this poor fellow is about to take his life. But the real purpose of this picture is that if you look just past that bubble of demons that are surrounding him, he's in a beautiful environment. So when I talk about, when I exhibit my artwork and talk about post-traumatic growth and recovery, and I share my own experiences with that, I focus on how to get out of that bubble. And for me, someone had to reach in there and pull me out. So this is a very powerful image for me, and it kind of illustrates how I was feeling at one time. So a little bit about me. I became an EMT back in 1996 and a full-time paramedic and firefighter in 2003. We work in a largely elderly population. So as an advanced care paramedic, we get to do a lot of advanced procedures, lots of heart attacks, airway management. We do about 15 calls a day. For my service, we have 2 stations. We work 24-hour shifts. So I work 24 hours on the ambulance, then I'm off for 24 hours. Then I work 24 hours on the fire truck, and then I'm off for 5 days. It's a family-oriented environment, and we're next to a pretty busy freeway, so we do get some trauma. Here's some paintings that I did of our fire hall. Now, what happened to me is me and my platoon, we went and listened to the psychologist talk about PTSD and mental stress and trauma. And he listed all these different signs and symptoms. And at the time, I never knew I was like that paramedic where I was very confident and strong. And I was surrounded by this demon, but I didn't know. And the psychologist was listing off all these signs and symptoms. And, I realized that I had a lot of these symptoms, and I didn't realize that they could have been from work, their work-related trauma. And I really didn't know. And at the time, I actually was considering taking my life. But my brain chemistry was so altered that I thought that was my only option. It was a very scary time. And now when I think back at it, I'm now going through this phase of post-traumatic growth and recovery. And I now speak and share my experiences. Here's a picture that I did out of Las Vegas. These are all first responders. And it kind of represents the struggle that this paramedic in the middle is facing. The look on his face is he doesn't really care at that point which way he goes, but his peers are fighting for him. And then the demon, which represents trauma, is trying to take him. Now, as I traveled around and I interview, every time I travel, I interview my peers and I ask them, what it's like to work here. I'm interested in their protocols. I'm interested in seeing what type of mental health supports that they get. And once the conversation starts to flow, I kind of hear about their struggles. And I've narrowed it down to one of 3 things. So all the people that I've heard to, and we get tons and tons of emails every day from my peers that are expressing themselves. And they're telling me about some of the issues that they're having. And I can narrow it down to 3 different things. The person is validated. So sometimes we don't feel validated. An example of that is, maybe if you go and you have a bad call and you come back and either your coworker or your supervisor states that, well, I've done a call like that, it's not that bad. You don't feel validated, and that's a problem. Or you go see your therapist and your therapist tells you that, well, I speak to lots of other first responders and that's just kind of how it is. We don't feel this sense of validation. The second thing is being understood. An example of that is, if you go on a call and your dispatchers, maybe you went on a bad pediatric traumatic call and your dispatchers are kind of at you like, hey, let's get back on you got to get back on the road, and they don't really understand what you just experienced, and you need to take time to kind of process that. Or your supervisors, you come back from a bad call and then they're telling you that, you're over in your shoot time by 20 seconds when, you just experienced this literally a life and death experience. Or another example of not being understood is if you go home and you just need to be by yourself, or you need to stay home, or you need to just process your day, yet your family's kind of wondering why you're not helping around the house or doing chores or doing things. So that's feeling validated and understood is really important. The other thing is being supported. So if you do need help, isn't it great if someone just says, hey, what can I do to support you? What do you need for me to get you better? Versus, get back on the road, or, get your paperwork done, or what do you mean you need to change your uniform after that call? So based on the things that I've heard traveling around the world and speaking to thousands of my peers, and even now when I hear from some of the people that are struggling, I can narrow it down to one of these 3 things. And if we don't feel validated, understood, or supported, then we have this sense of perceived injustice. And that sense of perceived injustice is a big problem when it comes to our recovery. And in order to have that support system, that's meant to be our sanctuary. Now, there is a term called sanctuary trauma, which was first coined in the Vietnam War, where these vets were coming back and expecting to get treatment and help from the government, but instead received more trauma. So the definition of sanctuary trauma is it occurs when an individual who suffered a severe stressor next encounters what was expected to be a supportive and protective environment and discovers only more trauma. And sometimes that happens to us if we don't feel that we're validated, supported, or understood, then we have this perceived injustice, or we feel like we have this sanctuary trauma. So once I started hearing from all these stories about my peers saying that a lot of the source of their trauma wasn't so much the calls that they went on, it was things around the station or office politics, or I call it station stress, was the real cause of the trauma that they were facing. So on my social media, I did a quick survey, an unofficial survey. This was a couple years ago. And I asked the question, what's the source of your work stress? Is it emergency calls, or is it office politics? I had about 1,400 votes came in, and this is what they said. So emergency calls. Oh, let's see. Sorry. Emergency calls about 35%, and the office politics or station stress was 65%. So more people were saying that the trauma, the uncontrolled trauma, really wasn't the cause of their stress. It was the station stress or the office politics, which I found really interesting. Now, again, this isn't an official survey, but I found that information really interesting. As you know, this is the kind of story that I hear often. However, this year in February, just this past February, the International Journal of Environmental Research and Public Health, they did do a survey assessing the relative impact of diverse stressors among public safety personnel. So this is a study that was done, and they interviewed about 4,400 participants, firefighters, police, paramedics, dispatchers, and corrections. And they came up with some really interesting results when it comes to predictors of mental trauma for emergency workers. Now, Dr. Don McCleary, he's a scientist here in Canada who specializes in workplace trauma. And these are his takeaways. I'm just going to read what he said after reading this study. So according to this study and according to Dr. McCreary, he says non-traumatic workplace stressors appear to be more important than trauma exposures for poor mental health among public safety personnel, even though the public safety community is overly focused on the role of trauma. So when we talk about PTSD, we're always talking about, what caused that, which of course happens. But this study is showing that maybe there's other aspects that are causing these mental injuries for us. This is another thing he said regarding that study. The current results suggest that a successful action plan to address PTSD and other mental health disorders will likely depend, at least in part, on making changes to reduce organizational and operational stressors within the PSP organizations. So operational and organizational stressors are controllable stressors. So this is station stress. So examples of that would be a sense or perceived injustice sense or perceived sense of either favoritism, dealing with coworkers, excessive administration duties, constant changes in policies, staff shortages, pressures to volunteer your time, dealing with supervisors, inconsistent leadership styles, leaders, overemphasizing the negatives, internal investigations, or feeling that you need to prove yourself. Now, these are controllable factors and things that we can change that may improve our mental health and create that mental sanctuary, create that positive workspace for emergency workers. Here's another thing he said: the largest gains may be made by focusing on leadership training and support, improved organizational engagement, reduced stigma, improved sleep, and strengthening social support. So I found this very interesting study because it's something that we can control, it's something we can change, it's something that we can do to create this more supportive work environment, which will decrease our mental stress, decrease our events of PTSD, increase productivity, increase staff retention, decrease sick time. So there are things that we can do to promote a better work environment for emergency services. Now, here are some things that other services are doing. Another question is, how do we do that? How do we make this environment? How do we create this sanctuary for emergency workers? And here are a few things that other people have done. A peer support program. Now, peer support program, and I kind of see this kind of a three different system. The first is peer support, which is almost like a preventative program. Examples of that are to have a peer support team, and we have that in my department. We'll have a peer support team where people, they're aware of what's going on. They'll come and check in on us. Bigger departments, they'll actually have people with peer facilitator training. They'll have people on each platoon that are kind of in tune of what's going on, and they can check in on people. If I was a peer facilitator and I noticed that my partner was, acting differently or being more isolated, then I can check in with him and he'll feel more comfortable with me because we know each other. So a lot of services will have many peer facilitators or peer support people on each platoon. Another example is to track calls. Some departments, they'll track calls and they'll contact people. They may notice, hey, this paramedic or firefighter, he's been on 3 pediatric suicides in the last month. We should check in and just see how he's doing. So tracking calls, a lot of departments are doing that, and that's a kind of a preventative measure. Here in Canada, we have OSI-CAN, which is kind of groups where people can go and check in every week. It's small group therapy where they come in and they talk with their peers. And it's kind of a preventative way to just kind of check in, meet with like-minded people and kind of express with a trained peer facilitator that can lead that group. We also have here in Canada, the Mental Health Commission created this standard, and what the standard is, It's kind of like a mental health working group. So a lot of departments and organizations here in Canada, not only first responder emergency departments, they'll have a mental health working group. Again, this is a form of peer support or preventative measures to kind of foster this sanctuary or foster this mental health, a better mental health environment. Now, when things do happen and you do have those really bad events, then critical incident stress management is important. And that's an important aspect where there can be diffusing and debriefings, in case, your peer support or your preventative measures can only do so much. But, when you have these big events, then things have to happen. So we have a good CISM team, a great CISM team in our department, and most departments here have that for debriefing, diffusings. But what happens after that? What happens if someone does have to get off work and now they're coming back to work? I've seen a few departments have a good reintegration program, but this is something that's coming up. And when I talk about reintegration, I'm not only talking about training for the emergency workers that's coming back to work. The reintegration also involves training to the department, for the managers, the supervisors, and the other crew. How do we bring our brothers and sisters back to work? So reintegration training. So I think a good environment for mental health in the emergency services world would involve all three of these aspects: a good peer support system, a good CISM team, and a good reintegration program. A lot of the departments I've seen, and when I travel, they've had one, maybe two of these, but not many have all three. And I think that's what's needed to have a really good environment to create this sanctuary, which would promote validation, support, and understanding, which I think overall will decrease our mental trauma. Now, here's an image. This is probably the most graphic image I've ever done. It's also my favorite image. This is called "The Demon Eats the Ambulance Driver." And I understand ambulance driver is a very derogatory term. And when people looked at this picture, they think, yeah, the trauma finally took this paramedic. His arms are down. He's not defending himself. He's no longer a paramedic. He's an ambulance driver. And he's just given in to his trauma. But it doesn't need to be like that. We assume it's because of the calls we've attended, but I think often these things happen based on controllable factors. And for me, when I created this picture, this represents the moment when you want to take your life. You give up. Every day is a struggle. Every day you're just exhausted of trying to push back that terrible feeling, and you just don't want to feel anything anymore. And you just literally are going to be consumed by your trauma. And that's what this picture represents. Now, here's another picture. This is called Finding Peace. Now, here's a paramedic. And at first, it may look like it's a sad picture, but if you look in the top right-hand corner, and I'll emphasize it here a little bit, there's a demon, there's trauma. Now, he's screaming, this demon, because he no longer has the grips on this paramedic, because this paramedic is getting the support that he needs. So that support could be some form of validation, support, or understanding. It could be your peer support team. It could be a good CISM team. It could be the result of a good reintegration program. So it doesn't need to be like this first picture. If we can cultivate this nice work environment for people and support them when they need it the most. Here's a picture that I did. I want to say a few things about the COVID-19 process that's happening. I just finished, this is the final picture. I created 1,000 selfies. People were sending me pictures of themselves, and I found that, we all have this common uniform now. Everybody's wearing their PPE, and we all look the same. Doesn't matter what country that we're in. This is 1,000 portraits, over 1,300 people in it, and we're all brought together, and we all look the same in some way. So I created this project, and having a sense of togetherness and that we're in this together really helps me anyways, going through and working in this unprecedented time. So our CISM team at my department sent a PowerPoint and gave us some guidelines on what we should be doing during this time. And it was great for them to do that. I thought it was wonderful. And the information they gave was great. And here's a few of the things that they told me, my department, of ways to kind of navigate through this unprecedented time for emergency workers working in this this pandemic. Take a media break, which I think is great. There's so much going on with media. And what I do is I decide where I'm going to get my information from. I check in once a day, and then that's it. If I can, I'll try to avoid all the other things that are happening. And because when I hear so much about what's going on, it really kind of depresses me and gets me down. Create a self-care activity list. So when things are starting to get down, there's certain things that I do that make me feel a little bit better, and that could be different for everybody. Prepare for the long haul. Understand that we could be in this for a long time, and preparing for the long haul could mean something different for everybody. Recognize personal signs of stress. So take a personal inventory. What are the signs that you personally have of your own stress, and what can you do to change them? Here's some signs of poorly managed stress: sadness, shortening fuse, so you get really angry quickly; emotional numbness, poor attention to self-care; feeling exhausted, increased need for alcohol; excessive worrying or fear; easily startled, racing heart rate, nightmares; feeling empathetic trauma, or blaming others. Those are signs of poorly managed stress. Now here's some self-care techniques. Breathing and relaxing. My wife is a yoga teacher. Just a little plug for her. She has a YouTube channel. She's great. If you guys should subscribe to her. If you're feeling stressed, go to some of her classes. Okay, that's it for my wife. Healthy diet, sleep, and exercise. It's okay to say no. It's okay to feel crappy sometimes. It's not selfish to practice self-care. Again, we have to be in this for the long haul. And if we burn ourselves out, we're not going to be able to help anybody. Now I want to do a really quick self-assessment for everybody. I'm going to ask you 10 quick questions, and just do your own little yes or no. And this is great. I usually talk about stigma, but I'm not going to talk about that here. But the great thing about this is that you can do it on your own. No one needs to know. So I'm going to ask you these 10 quick questions, and just do a personal score for yourself. Do you have repeated disturbing dreams of stressful experience? 2, do you suddenly act or feel as if a stressful experience were happening again, as if you were reliving it? 3, do you feel very upset when something reminds you of a stressful experience? 4, have you had skipping, racing, or pounding of the heart? 5, do you blame yourself or someone else for a stressful experience or what happened after it? 6, do you have trouble experiencing positive feelings? For example, being unable to feel happiness or have loving feelings for people close to you? 7, do you take too many risks or do things that could cause you harm? 8, do you have difficulty sleeping, either difficulty falling asleep, waking up in the middle of the night, early morning awakening, or sleeping excessively? 9, do you find it difficult to control the worries, or do they interfere with your ability to focus on what you are doing? And 10, have you thought a lot about death or felt like you wanted to die? Now just be honest with yourself. Now these questions I just took off an online self-assessment, and I'm sure wherever you're from, you can do a PTSD online self-assessment and it will come up with these questions. This one was from Canada. It's 35 questions, and based on what you answer, it will give you suggestions, it will give you guidelines, it will give you phone numbers to contact, it will give you links, and it will help you out. The great thing about this is that no one needs to know. Your supervisor doesn't need to know, your friends don't need to know, your family doesn't need to know. You can do this on your own. If you don't feel strong enough, or you feel like you can't come forward and ask someone, or you don't have that support group in place, you can do this online. I'm the president of the Peer Recovery and Resiliency Society, and what we do is we try to promote brotherhood and kinship and sisterhood all across the world. I have a book that I sell and the proceeds from that, and I hope if conferences are ever a thing again, we do a conference every 2 years, and I invite people to come, and we have a scholarship. And follow my social media. This is my social media pages. When we're ready to have a conference again, we will sponsor someone to come to our conference. So we'll pay for your flight, your hotel. You have to tell us why you want to come. We've done this twice already, and it'll be great to have some of you come to our next conference, whenever that's going to be, if conferences is a thing again. So that's the end of my presentation. I think we'll do questions now, Rose, or are we going to do it at the end?
Yes, thank you so much, Dan, for this very interesting, insightful presentation, and also for sharing with us some of your amazing artwork also. If anyone has questions, you can ask them now. We'll take a couple of minutes in case anyone would like to ask. You can either raise your hand or you can write in the question box. So we have one comment that is just saying that it is very true that when senior management are so far removed from the trauma and also so process driven, yet emergency workers are already looking for support from management. So I think that was during your presentation. And we also have a comment from Irache. Great presentation, thank you. I'd like to focus a bit on PSAP operators. Having heard concerns about exposing them to very sensitive images, live or still, shared directly with the PSAP or in social media, which traditionally they weren't exposed to. How could we balance that with the increasing adoption of multimedia communications in PSAPs?
Yeah, like I said, I don't, for my images, I don't, I'm not sure if you're referring to my images specifically or other things that you see in social media. For me, in my artwork, I don't censor my artwork. It needs to be authentic for me. Like I said, as part of my own healing process. And the more authentic that it is for me, it's a more authentic way for me to purge that memory for me. And I think if I do, when I create the artwork and I think, okay, what are other people going to think, or how is this going to affect other people? Of course, I don't want people to be traumatized by it, but I want it to be authentic. It needs to be real, right?
I think also Arachi is just saying that she didn't mean your artwork. She meant that in the control centers, when we're adopting more multimedia communications, so that the call takers may be exposed to, say, images on social media of emergencies, or for instance, if there is live streaming into the PSAP of an accident, etc. Is there anything that you would advise to kind of balance the increase in multimedia communications coming to them, so the amount of things that they're exposed to, while also trying to protect the call takers themselves, their mental health?
Yeah, I have lots of respect for the call takers and communications, and I feel sometimes it's even worse for them because they're the first responders. They're listening to things as it happen. Often we get there and it's after the fact. My advice for that would be just to turn stuff off. If you're being, if you see things through social media or imagery that's upsetting you, then turn it off. Just don't watch it. But process it. Find a way. Reach out if you're finding that you are that affected. Because I can understand that, but I can empathize with that. As a call taker, if you're taking that call, you're talking to that person, and then you're seeing the imagery of it after, then that's a really strong connection. And if you are feeling that affected from it, then that's a sign of potential trauma as well, and that needs to be addressed. And like that first picture that I did of the paramedic being surrounded by his demons, we try for the longest time to think, okay, well, tomorrow's going to be better. The next day is going to be okay. But sometimes someone needs to reach in there and pull you out. You need the help. That questionnaire that I did, if a lot of those things really struck with you, then it's time to utilize your resources the best you can and get the help that you need.
And we have another comment just saying, I just wanted to say a huge thank you for everything you do and your honesty. I don't know if there's any other questions for Dan. I think everyone's just taking in your presentation. And if there's no more questions, we can move on to the next one. Thank you so much for this very interesting presentation.
Great, thank you.
And so now we'll move on to Steve, who's going to give his presentation. And yes, I pass over now to Steve.
Okay, Thank you, Rose, and good afternoon, everybody, and thank you for giving me the opportunity to take part in this event today. Visually, a bit of a tough act to follow, having had a chance to look at Daniel's artwork, which is absolutely spectacular. So my name is Group Manager Steve McLinden. I've been an operational firefighter and and a senior manager and officer within the UK Fire Service for the last 32 years. And for the last 16, I've been with Mid and West Wales Fire and Rescue Service. My current role is I'm heading up a program where we're looking at digital transformation within the organization. How can we take existing or create new technology to make the workplace and the operational environment safer for our end users, for our firefighters, and ultimately improve the outcomes and results for the communities that we serve. Although a different subject matter to the areas that Daniel was talking about, there is actually quite a lot of synergy in relation to the areas that we're looking at and how we can maybe do a small part in maybe releasing or avoiding some of the triggers where first responders post-incident start to question and challenge what they've done. And that is in particular is in relation to the situational awareness that they had at the time, and then obviously the wonderful phenomenon of hindsight where everybody else is critical and gets to see everything you've seen, but with the knowledge of what happens and how it happened. And no, there's not really a better example of that at the moment than the tragic events of the Grenfell Tower fire in London, and obviously the outcomes and the investigations and reviews from that. And having spoken to quite a few people and friends who work for and were part of that incident, I think some of the issues that Daniel spoke about are absolutely right and prevalent, and hopefully some of the areas that I'm going to go through now may go some way to start to relieve some of those pressures that are put on first responders. So what I'm going to do is I'm going to work through and talk about my T20 program, the Transformation 2020, or we call it T20. Just give you a quick overview of some of the philosophy which we work for when we're looking to introduce technology into the operational environment. I'll quickly run through what we're doing pre-incident and where some of the technology is coming in there. Then we'll focus on some of the technology we're looking to put in place to enhance safety through enhanced situational awareness, and then being able to look at post-incident and do some of the really important stuff is about being able to self-review and also use the technology to provide a real-time perspective without hindsight, to allow people who are reviewing the actions and decisions made by incident commanders to see it from the vantage point that they did at the time. So I think for us, one of the key things we've been doing with all technology and trying to resolve some of the wicked issues and outstanding challenges where we can improve safety for firefighters has always been about making sure that what we're doing meets the end user's need. And that's why we're very unapologetic within our program, where we say that the end user must be at the center of any innovation or any change to the way they work and operate and possibly think. But one of the things we always do before we look at any new technology is we actually ask the question, is technology the best option? Is it the right thing to do? And we always refer back to years ago, NASA spent millions of dollars trying to invent a pen that worked in space. And then Russia just used a pencil, did exactly the same thing. So there really wasn't anything to be gained by taking something quite simple and effective and trying to modernize it or change it. So the four pillars that we work to take the ideas and the wicked issues and then create a viable solution is that, first of all, we do engage with the end user, but we don't give them a blank sheet of paper. It's our role to go and do the research and investigations and get the understanding as to what the challenges are and what the potential solutions are, and then present them with an option or a range of options and get them involved to help refine what the final solution should be. with any technology, especially within the operational environment, it has to work on the principle of Fisher Price. Other small child's toys are also available. But what we're saying is the solution and technology must be bright, intuitive, simple to use. We don't want our end users having to think or feel like they're Facebook coders to be able to use the solution. One of the things we learned from feedback also was that they need to be able to feel confident that they can undo any process which they've done. We also look to make sure that the technology is built on the basis of Lego, where it's scalable, it can be built up, it can be built down, it can be changed as and when the landscape and our understanding and use of this technology works. What we're saying in essence there is that we're not interested in proprietary software or hardware which can only work on its own. And finally, especially with the sharing of information and collecting information and disseminating it, we want all our systems to work on the principle of Ohio, which is only handle it once. We shouldn't have to be repeatedly entering in the same data that the system already holds in us. Any data input, particularly in the operational environment, needs to be new information, is information which we haven't got. So these are the sort of guiding principles which we work to. And as you'll see through our presentation, one of the other things we've done is when we've engaged with external suppliers, we have been very keen to move away from a customer-supplier relationship. And that has allowed us to actually start to develop some really effective and beneficial partnerships. And you'll hear me mention partnership working throughout, and it's something which we've had great success with and something we're extremely proud of. So in relation to the structure of this presentation, the first thing that we're looking at is where technology can be used to provide the infrastructure and make sure the resources and the equipment are in place prior to it being used. So one thing we've done is taken a quite well-established technology in RFID, radio frequency ID, and we've gone through an exercise where we've put tags on all of our operational equipment. The plan for this moving forward is that over time we will start to scan and get a better understanding of where the kit's used, how often it's used, and then I'm sure with a lot of first responders the expectations and breadth of work we undertake is getting bigger and bigger, and therefore we need to carry more and more kit. One of the phenomenons we have in the UK Fire and Rescue Service is generally within a service, the equipment on one fire appliance will be more or less the same as the other fire appliance, which can be 90, 100 miles away, even though the risk profile is different. So what we're looking to do with the RFID technology is to provide real-time tracking for our assets. From a health and safety point of view, that means we know where it is and what condition it is and it's being tested. One of the other big projects which we've done is the introduction of tracking of our PPE, our fire kit, which I'll go into in a second on the next slide. But what we're keen to do is to make sure that we start getting real-time data and historical data so we can understand where and when our equipment's used to make sure that it is the right kit and that the kit is being used to its optimal. Obviously, then this will ensure that end users have the right kit, but also then there will be significant financial efficiencies where we can remove kit we don't need or don't use, but we've had because we've always had it. And then we can also start to put some of the new technology on, which will make our crews safer and more effective. So one of the things we are implementing as we speak is we've basically decided to move away from issuing each firefighter with 2 sets of kit for their own exclusive use and move to more of a size issue pool stock. To do this, we've had to introduce some storage solutions which allows for real-time tracking of the assets. So the top left-hand corner, you'll see there's a storage unit, which is an RFID enabled storage unit which tracks the spare items of PPE that are in it. Hopefully you'll see on the right hand side the cartoon artwork Really, we're trying to change the process. So a firefighter just scans their tunic in, put it in to be washed, and it tells them that the next nearest piece of kit is in the storage locker there, or in the rare occasion that it isn't, where the nearest one is. What this introduction to this system has allowed us to do is, one, it makes the end user experience a lot better, because we had significant problems, especially with our service area in Wales, where we cover 2/3 of the land mass of Wales, which is 12,000 square miles. Is that kit sometimes goes to the wrong station, and it's quite an effort to get that kit back. It also means that we're able to reduce our stock holding, because with the legacy system, with everybody being issued 2 sets of kit, there's 50% of all kit is unavailable to anybody else apart from that person at any one time, which is obviously quite costly and not the most efficient way. So basically, the principle now is that with the PPE solution, all kit will be tracked, but basically every individual will have access to every piece of PPE that fits them throughout the organization, which isn't allocated to an individual. What we're looking at is that this is going to provide, as I said, we're looking at a £500,000 saving from our initial procurement profile if we were to do like for like, but also we're looking to save about £100,000 per year. The big thing from a health and safety point of view for us is, one, we can real-time track where our kit is and make sure it's fit for purpose. But also, there's a lot of discussions nationally and internationally around the contaminants of PPE by carcinogenics and smoke. Currently, if we had to wash our PPE every single time it came in contact with smoke, we would probably have to buy around about another 2,000 assets to introduce into our system. So basically, we would need to give every individual firefighter an extra set of kit. With the new size issue model, the PPE solution, that actually reduces down, that we estimate we would only need to buy about another 300 assets, and we would be able to maintain PPE for our personnel at all times. So again, it's a much more efficient and effective way for us to work, and it makes the end user experience a lot better. So one of the other things we've been working on is about how can we get better visual information to our incident commanders. So we've been working with one of our partners, Fracture Reality, and these 3D models have actually been created from standard 2-dimensional CAD drawings, and they've developed a software system for us where we can put the original CAD drawings in, and then we get building plans and interactive plans like these. Obviously, then that enables pre-incident learning and special risk familiarization, but also then we can use these post-incident, particularly when we overlay it into the other aspects which we're looking at. So one of the things we're looking to do on the fire ground or at operational incidents is that we want to use technology to the fore. So one of the first things we recognize is that we need to be able to bring along our own digital infrastructure, from which then all the different technology devices such as GPS tracking, RFID, body cameras, data sharing, drone images can all feed into. We've also undertaken quite a bit of innovation work, where we've also worked with one of our partners, Accelerate, and we've created an instantly deployable portable 4G Wi-Fi router box, which creates a 4G Wi-Fi bubble, probably around in clear line of sight about 100 meters. But that allows us to build our own ecosystem to run our digital technology from. One of the other things we've had great success with is we introduced drones about 3 years ago, and we've been able to facilitate the use of drones. They're embedded with our urban search and rescue teams, and we're one of the few teams within the UK and internationally who can actually operate drones with our search and rescue dogs. What we've found with that is the unprecedented level of situational awareness that we got from the drones has enabled incident commanders to make much better decisions, because they're able to see things they wouldn't normally be able to see, especially with the thermal imaging capability, which you can see on the top right hand corner. What we've also found, though, that this has been brilliant for post-incident learning. So when incident commanders go back and review, it gives them a safe environment to look at, did I actually see everything? Was I fully aware? And this is where it ties back into the presentation from Daniel. Is one of the things I know from experience and from my peers is that often you reflect on incidents and said, did I do everything to the best I could? Did I see everything? Was I sighted? You know, did I make the best decisions I could? We've now starting to get a capability where we can start to reflect on that and see it in relative real time. Obviously, all this new technology and the ability to stream data necessitates having a platform which is able to be used, and that's where we've worked with one of our other partners, a company called Unblur, where we've worked with them to develop an enhanced situational awareness and digital decision-making platform. And this platform is named Iris, but basically it's a mapping and tracking and image streaming platform which allows anybody who has a login globally to see in real time what the incident commander can see, if helmet cameras or body cameras or drone images are being used, or equally if decisions are being made, so they can look at the risk assessments, they can look at the decision logs, and they can also track externally and hopefully in the future internally where firefighters are. So this is primarily will be used extensively on larger jobs where there's time to work it, but it's initially there to be a passive tool to collect the data. So post-incident, the incident commander and their crew can reflect or post-incident review for an investigation or for a fire investigation. There's real-time data there. And this is where I was talking about, it can sort of alleviate some of the hindsight elements, because people will be able to see what the incident commander saw and then be able to base whether the decision made was a good decision or not based on the information that they had. One of the other projects which I've always never understood why we haven't got it, and it's one of these things as an incident commander, when you commit people into the threshold of a building, really the only last guaranteed location you've got for them is when they go through the threshold of that door, and then you've got a very good guess or estimate as to where those crews are. So my ambition has always been, let's help our incident commanders to see through walls. So in early 2019, we were very fortunate to be awarded £1.25 million of UK government grant funding to develop instantly deployable firefight tracking within buildings. We're currently within phase 2. We did the phase 1, which was a 3-month R&D phase where we selected from 49 companies down to 5. At the end of phase 1, there were 3 viable development options presented out of the 5. We were really fortunate because of the partnership approach and the unified desire from all 5 companies, particularly the 3 who had viable options, to come up with a viable solution for us. 2 of the companies did actually decide to collaborate together for phase 2. So at the moment we have 2 companies who we are confident are going to deliver 2 commercial solutions into the market by hopefully April 2021. So the 2 companies, and again, these are our partners. These are people that we speak to on a weekly basis. We have very open and constructive conversations, but we're both focused, or all 3 of us are focused on getting to the end solution. And not only are we collaborating with them as the challenge owners, the 2 companies are actually collaborating with each other to make sure that the funding available to them is used in the most effective way. So the 2 companies which we've got are primarily Ox and Grieve, with a range of other partners such as Draeger and Dinium Robot, and then Bramwith, who are working with a range of partners on their side too. So what we're being able to develop is start to actually be able to track where firefighters are. Primarily, this is going to be for the entry control operatives outside who are responsible and monitoring where the crews are. They're going to be able to see where their crews are within the building by being able to overlay visually the breadcrumb trail. And obviously post incident, then this is going to be really useful too. As you can see with the right hand screen, the brown width offering, they're able to overlay their digital breadcrumb into augmented reality. And you can see the potential here that if the breathing apparatus crews, the emergency teams have a heads up display, there is a virtual guideline that they'll be able to follow. I think the thing to bear in mind with this is how difficult this actually is, because this is not based on putting an infrastructure into the building. One of the criteria was that from turning up to deploying and being able to track, the challenge winners had 90 seconds to be able to do that, and there wasn't to be any putting out beacons or running out cables. It was literally press a button and go. So post incident then, and I think this is where we talk about the hindsight. It's really important for us to be able to reflect in an element of safety and be able to understand what the incident commander saw and what their decisions were at the time. But as you can see, if we were to describe a fire in a hotel, you would have your understanding of what it was and your imagination. But again, is by being able to actually reflect and see in real time what the incident commander saw, see the tracks of where the crews have gone. There's so much operational learning and validation. And hopefully, again, reflecting back on Daniel's presentation, it may give some solace or some comfort to the first responders who may be torturing themselves as to thinking, could we have done more? Is there anything more we could have done? When actually the data post-incident may actually show that actually no, there wasn't much more based on the information which you had at that time. I think just the last slide from me really is just to sort of share sort of the two key elements which have been the secret of our success in being able to move these innovation projects forward in the way and time frame which we have. And that is one, because we've had our end users at the center of the innovation. We've been solving problems for them. We've not been focused on the technology and how shiny and how wonderful that is. We've actually been focusing on what does the end user need, how will they use it, and what will the benefits be. The other thing we've found is by taking this partnership approach and moving away from a traditional customer supplier approach, we have been absolutely overwhelmed and astounded by the level of support and guidance that these companies are prepared to give. And it has been very much through that we've been able to deliver the progress or achieve the progress which we've made so far. There is one caveat for us though, and it's one thing we're working with our partners at Cardiff University. The one area we are not sure on yet is we're not quite sure what the reaction to the technology is going to be once it's actually deployed in the operational environment. So we're working with computer science experts and psychologists who specialize in the use of technology in high pressure and dynamic situations to actually monitor and get an understanding as to whether the use of technology enhances and makes the decision-making process easier. If there are delays or issues that come up, hopefully we'll get a clear understanding from a psychological perspective or of how that has happened and what can be done to mitigate that. We're also acutely aware that because we're able to suddenly give far more information and situational awareness, such as thermal imaging pictures, GPS tracking, internal tracking, aerial views, all this different data which we currently don't have, are we going to get to a position where suddenly people become adverse to making decisions because not all of those component parts are actually there. So we're obviously keen to get the technology in, but we're obviously doing it with an air of caution, because again, our focus and our ambition is to make our firefighters safer and make them more efficient and better at the job which they do to deliver better outcomes. And it would be remiss of us just to issue the technology and go, that's it, problem solved, because it may generate, we hope it doesn't, but it may well generate some different problems which we may need to navigate and resolve. So that's me. There's my contact details if anybody has any questions, but thank you for your time, and thank you for giving me the opportunity to share with you what we're doing within Mid and West Wales Fire and Rescue Service and our T20 programme.
Thank you so much, Steve, for this very interesting presentation. If anyone has any questions, you can type them in the box, or you can raise your hand if you would like to speak. I think it was also very interesting to hear about everything that you're doing in innovation and how this links to decision making, and then to what Daniel was talking about with the mental health awareness side. So I think it's really interesting to make this link between the two presentations. We'll just see if anyone has any questions. I think there's no questions, which is a sign of a comprehensive presentation. So we'd like to just say thank you so much to Steve and Daniel for these presentations. We'll end the webinar for today, but just to know that this has been recorded. So if you want to re-watch anything, if you want to see the slides again, you can see those on our website. And we actually do have a question. Do you have any innovation research regarding researching and rescuing people with disabilities? I think this is one to you, Steve.
Not to hand. It's not a question I've actually been asked, because I suppose it depends in what the type of disability is, because often rescue from a compartment fire or a building, normally the casualties are incapacitated, so we carry them out and we move them. We do seem to do a lot more within our service bariatric rescues, and we've got specialist teams and specialist equipment to help that. Yeah, I'm not quite sure what the specific disability or how that would reflect on how we would do things any differently.
Okay, so thank you so much, the presenters. The person that asked just says thanks for answering the question. So we'll end the webinar here. Thank you so much for joining us. And again, if you'd want to rewatch or see any of the slides, you can find them on our website. So thanks everyone, and have a nice evening.